So now I would like to invite Dr. José Alonso from the Ministry of Health of Brazil. And we're going to change gears a little bit and talk about an important response that Brazil has given to the HIV pandemic. Thank you very much, Flavia. Thank you, Aladiv, for the invitation and for the opportunity to share a little bit of the work we do. Just 1 minute before I share my presentation.
Vocês conseguem ver minha apresentação?
Can you see my presentation? We see it, but it's not on presentation mode.
Vocês conseguem ver minha apresentação?
Sim, mas ela não está.
We see it, but it's not in presentation mode.
Agora sim.
Now it's working.
Então, de novo, muito obrigado.
So, again, thank you for the invitation, and I'm going to talk briefly about the challenges that Brazil has faced regarding diagnostic issues in the search of reaching our 90-90-90 goals. I'll share some of the Brazil data. First of all, I would like to talk about... I cannot move my slides. Oh, there it is. First, I would like to talk briefly about the history of DCCI, which is the department where I work at. And this timeline is similar to the HIV timeline. So in 1982, which was the year of the first official AIDS diagnosis in Brazil, and then in 1985, HIV was discovered by Montagnier and et al. And we already had the first HIV test available. So in 1982, but in Brazil, but in Europe and in the United States, there had been previous cases. And we can compare that to the current pandemic, how long it took before we got our first commercial anti-COVID test and the time it took to have our first HIV test. Just as a side note on how technology have allowed us to move much faster today. And then in 1986, the National Program for STDs and AIDS were created from the Ministry of Health. And after that, we have the history of HIV diagnosis in Brazil. In 1987, we created the first center for diagnosis with an attempt to decentralize this work. In 1988, our public health system was created, and that included health coverage to every Brazilian citizen. In 1990, we have the legislation for the National Public Health System.
A gente tem aí em 91, né?
In 1991, after the creation of the public health system, we started the process for the acquisition and the distribution of antiretroviral drugs in Brazil. In 2009, we incorporated this to the program or actually we included hepatitis, viral hepatitis, in the same department using treating STDs and AIDS. In 2013, we allowed nurses to conduct rapid HIV tests, and we started offering universal antiretroviral therapy for every person with HIV in Brazil. In 2017, we took an important step, which was the first registration or the first authorization for an auto test in Brazil. This became a public policy in Brazil, and today we have the Ministry of Health distributes these auto tests to the population. And in 2019, the STD/AIDS department became part of other departments that focuses on tuberculosis, because tuberculosis has to do with the mortality rate of HIV, so that allowed us to act more effectively. And this new department became the chronic disease departments and sexually transmitted infections. And this department has some priorities. Because if we look at the list of priorities, both the ones that are connected to HIV and other diseases, diagnosis is present in all priorities. So if I want to reduce the mortality of people living with HIV or with a co-infection of tuberculosis, I need an early diagnosis so they can focus on their treatment. So tuberculosis, expansion of access to treatment, expansion to action to prevention. Diagnosis is part of all these actions. So it's important to remember how relevant diagnosis is every time we are taking measurements to fight an infectious disease. And now I want to talk a little bit about the 1990 initiative. It was proposed by UNAIDS in 2014 and established targets for many countries that were signatory to the pact by 2020. So last year was the final year for countries to assess how close they were in meeting the goals established by the 1990 initiative. This initiative serves as a preparation process for an even more ambitious target, which is the end of the HIV pandemic as a public health problem by 2030. So 1990 doesn't end in 2020. Now we start working with more ambitious targets like 95, 95, 95. I will give you more details on these numbers in a minute. And this initiative included consultations with the policymakers in many countries. And the goal of this initiative is that by 2020, 90% of people living with HIV are aware of their condition, so they have a diagnosis. 90% of people with a diagnosis are receiving treatment, and 90% of people that are receiving treatment are in viral suppression. So in order for us to reach these targets, we need a joint action regarding the different health programs from many countries so we can reach those numbers, because the final goal is to get to viral suppression, because when I get to that point, I reduce my viral load or the viral load that exists in the population, and I can reduce the HIV transmission. And I can more efficiently implement actions that focus on prevention. So for a country to know if... Next slide.
So for a country to monitor its status to actually reach 90-90-90 is an effort to instruct countries to create a cascade of continuous care. So you have to understand that this cascade takes into account several epidemiologic data from HIV, data from the assistant of those people living with HIV. And we have 2 documents in Brazil regarding that. So we have the recently launched the epidemiologic bulletin regarding HIV/AIDS of 2021, and we have the HIV clinical monitoring report from 2020. We will have the 2021 available very soon. So we have those 2 documents, one from data from 2021 and the other one from data from 2020. Both are free and available on those hyperlinks. So now I would like to talk a little bit about the figures of HIV in Brazil. So in 2020, just like we can see in the epidemiologic bulletin, we've had 32,701 new cases. If we look at the timeline since the beginning of notified cases, it's 381,793 cases of AIDS in Brazil. We have to make that very clear, because for a long time in Brazil, we were only identifying AIDS cases and not HIV cases. HIV is more recent. So that's why we have these 381,000 notified cases. Up to a certain year, we've had only AIDS cases notified, and just recently we've started to notify HIV cases as well. In 2019 were 43,311 cases, and we've seen a reduction of cases in 2020. We see this as a result of the impact of the pandemic, that due to the social distancing measures at the beginning of the pandemic caused people to isolate, and so healthcare services were not sought after, and we've seen several healthcare professionals moving their attention and their service to deal with COVID. So there was a very important impact of the pandemic. We had attitudes to maintain diagnostics, but this impact is very significant. This is the detection rate. At the beginning, we had national data, and now we have data divided by region. So you're able to see a detection rate by 100,000 inhabitants, and we see a significant decrease from 2019 to 2020 in all Brazilian regions. However, we're also able to see that the mortality coefficient as a good result is also decreasing, and that is a direct result of the distribution of antiretrovirals for those living with HIV. This is an action that had a very positive impact regarding mortality, with a very significant reduction in the mortality rates, and that continues to decrease. During the pandemic, other creative options had to be conducted to distribute medication for people.
Tá. E aí, também no campo das boas notícias, que a gente pode, que os nossos dados, eles
There's
demonstram,
also good news from our data, which is that if we look at children below 5 years of age, we've seen a decrease in new infection cases, and we've had a sharp decrease in 2020. The detection of pregnant women is still high, but this is positive because if we're able to have a prenatal detection, we are able to work on prevention of vertical transmission. So this is a very important piece of information to fight HIV in Brazil. We've seen a very significant decrease
nos casos em crianças menores de
in of cases in children below 5.
Também a gente continuando aí sobre a questão do pré-natal, certo? Então,
So here's a chart showing the improvement on diagnostics during prenatal.
Em 10 anos, a gente
In 10 years, we are able to see an increase of 30% from 2010 to 2020 in the detection of HIV in pregnant women. So that is not a bad thing, like I said, because we can implement prevention measures regarding vertical transmission. And this is something positive if we look at a broader picture of fighting HIV in Brazil.
Como eu falei para vocês, a taxa de detecção em gestantes, segundo região, a gente
So
tem
this is the detection rate of HIV in pregnant women per region. So we can see an increase of the detection rate, but that is still positive regarding the implementation of prevention measures of vertical transmission.
Também aí a gente olhando, né, especificamente a detecção de AIDS em menores de 5
This
anos.
is the detection rate of AIDS in children below 5 per region. So we see a reduction trend in children below 5.
E aí, quando a gente vai falar sobre a distribuição dos casos de HIV,
So this is a chart showing the distribution of cases of HIV and AIDS considering age and sex. So in Brazil, we have an epidemic that is more prevalent in men. Men account for almost 70% of cases, and women are around 30%. But we also see an important feature in Brazil in 2020. We've seen younger people being affected. So we see that from 20 to 30 years concentrate the largest amount of people infected. And this is very important regarding the pandemic in Brazil, because now we see the need to focus on specific layers of the population to deal with the prevention of HIV/AIDS. So we see that younger people are more vulnerable to the transmission right now. So we have to pay attention to this population. So people from 20 to 34 years of age. But when we think about diagnostics, diagnostics do not happen right away after the infection. So we have to think that people that are 20 might have been infected 2 or 3 years before diagnostics. So we have a very young population getting infected, and we have to really pay attention to this regarding HIV transmission. One other important aspect regarding HIV epidemic is the late diagnosis. So, like I mentioned, people who are 20, 24 might have been infected 2-3 years before diagnostics, and we can see this in the white cell count in the first exam that they take in the healthcare system. So here is data from 2020. 28% of people who start a treatment in the public healthcare system, they have their white blood cell count below 200. So it's a sign that this infection occurred a little before the diagnostics, and this is something that we have to fight in Brazil, and this is going to be our focus in the future. So what is this population that we're dealing with, people who are living with HIV in Brazil? Today, Brazil lives a concentrated epidemic, so to speak. It's concentrated to certain clusters of the population. This is data from independent studies, some of them conducted by the Ministry of Health, but data show that in general population, the epidemic affects 0.4% of the population. But when we deal with specific groups, we see a high prevalence of HIV infection. Some studies show a prevalence of HIV among men who have sex with men, ranging, and the gay population ranging from 1 to 14%. If we work with the trans population, this is a highly vulnerable population with a high prevalence that can reach up to 36% of prevalence of HIV. And there are other priority populations like sex workers, women who are sex workers, and drug users. So what we can see in this chart is the populations that need to be focused, populations that we call key populations and priority populations regarding HIV. So who are those populations? HIV is an infection that affects some people who have certain vulnerabilities. So then we have key populations, which are segments with unproportional prevalences compared to the population in general. And we have priority populations, people with vulnerabilities associated to their lifestyle or social, historical, or structural context. So we have to focus on them when we think about fighting HIV infection.
These populations are connected to these vulnerabilities, the vulnerabilities that these people face. So social contexts of discrimination that will affect the service that is provided to these people, because many times these people don't look for their health services in order to get a diagnosis or to access treatment. So despite that, 45,000 people started for an HIV/AIDS treatment in 2021. And remember what I said about the notification. even though the number of notification that I previously presented is a reality, from 2012 to 2020, 666,000 people are receiving HIV treatment in Brazil. In 2021, we have 694,000 people receiving treatment, which is highly significant because we need to treat all of them. And we are working with growing rates of distribution of antiretroviral therapies. And like I mentioned before, what helps in the adherence to this antiretroviral treatment is because of the COVID pandemic, in order to ensure that people living with HIV didn't need to go too often to a health clinic to collect their treatment, the Ministry of Health allowed for the antiretroviral treatment to be distributed within 90 days. Before that, people used to collect their drugs up until 60 days, and that was expanded to 90 days, which was a very successful experience. And since the implementation of this measure from 2019 to 2021, we see an increase in the number of people that collect their treatment every 90 days. And we hope to see that number grow as time goes by. We also work to decentralize the diagnostic services because we need to test more people, we need to detect the virus so we can start treatment for more people. Today in Brazil, the average time for starting the treatment is 30 days after a patient accesses a health service. But when patients come to their health services, it's not usually when they're doing their first test. This varies a lot depending on the region of Brazil. But our work is to reduce the time to start the treatment. 30 days is still too long. We need to have an earlier start, and tests have a great impact on that. And as you can see from the 2020 to 2021 numbers, we continue to expand the distribution of tests. And I mentioned all this data to all of you to give you an overview on how we can get to this continuous care cascade. This is the most updated version we have for this in Brazil. With the first set of bars is a number of people with diagnosis of HIV in Brazil. Different colors show the historical series from 2012 up until 2020. So the first set of bar talks about people with a diagnosis. The second bar, people that are receiving treatment. And the third set talks about people that have reached viral suppression. They are undetectable. And Brazil was able to surpass the 90% target that have reached viral suppression. Unfortunately, the COVID pandemic had an impact on all diagnostic actions. After a historical trend of growth in the number of cases diagnosed, from 2019 to 2020, unfortunately, we saw a drop. And we connect that to the COVID pandemic that had an impact not only in the HIV diagnosis, but in other diseases as well. What are the challenges that we have to expand access to diagnosis? Brazil is a huge country. It's the size of a continent. So we do have a large diversity in the different regions. In the North region, we have many remote areas that are difficult to access. And in São Paulo, that has a complete different set of barriers. But expanding diagnosis in these remote areas is a challenge to be surpassed. We need to expand access to the key and priority population groups, because the challenge might not be geographic, it can be social, and that has an impact on the key population. We need to reduce the response time to users. They need to get an answer when they are in the health service center. And we need to allow for testing to happen in specific contexts, so we make sure everyone has access to it. And technology exists for that. Technology has presented us different options and different evolutions, so we can overcome those challenges. Today we have point of care testing, which is conducted in the same place where patients are being seen by their health professionals. We have a near point of care testing. In this case, I need some sort of lab infrastructure, but it's a minimum infrastructure. And it is a device that is used under demand and that allows me to give an immediate response to patients. And I have laboratory testing, and in this case, I'm talking about locations that can work on a high volume, so we can centralize a large number of samples to conduct these large-scale testings. The challenge here is how I can fit all three options and have them working together as a network so I can provide a better service to the population. Next one, please. If we could go back one, please. And this is just a quick example of the different types of technology that are available today in Brazil. So for point of care tests, we have the immunochromatography tests. For near point of care tests, we have what we call rapid molecular biology technology. So they use cartridges. And we have automated molecular biology, which is present in large labs. So there are many options in this technology menu to choose from, with the goal of providing the best treatment for patients. So I have laboratory assays and rapid nucleic acids tests, including immunochromatography tests. These are different options with specific applications. And many times we wonder, regardless of anything else, we have this trend. We often try to rank these tests. And if there's one thing that Brazil has taught us, the Brazilian experience has taught us, is that there is no best test. It depends on the population, it depends on the goal you're trying to reach. I always need to evaluate the risks and the benefits before I implement a diagnosis technology. What are my risks? I can have a false positive or a false negative. What is the gain in using these tests? I have access, I have an individual benefit and a collective benefit. There will never be an ideal test, but I need to balance the risks and the benefits, and I need to use the tests in order to minimize the risk portion of this equation. So I need to think about who am I trying to reach with these technologies. So today, regarding the different actions that we take in our department, we try to create a network structure that is inspired in a pyramid shape. I have different levels of complexity that go from the level 0, which is the minimum level of complexity, up until a level 4, in which I'm using high-tech technology in reference labs that have a specific role to play in this network. But this division in complexity levels allow me to create different strategy for tests. I can have tests that is based on traditional health services and do other testing strategies that can reach these community environments, especially for the key population groups, and the possibility of testing through peers and partners, like the strategies that we use to distribute self-tests in Brazil. It is very important regarding the different actions that the Ministry of Health implement for us to think that diagnosis need to be kind of safely conducted, both for the patient as well as for the health professional conducting the tests. So for that, the Ministry of Health works with strategic partnership and different actions to ensure the quality of the results, especially when talking about these rapid tests that are being used by people who don't have a background in health. Next one, please.
E aí, além dessas, de todas
So besides,
A gente perdeu o seu som.
José, we have lost you.
Eu acho que o José está tendo probleminha com a internet dele.
José is having a problem with his internet connection.
Vamos voltar aqui então. E aí,
So let's go back to the main room and let's see if he can figure that out. I'm sure, I think he's having a connection problem.
Bom, a gente está aí com avançar da hora.
So we are a little bit behind schedule.
Eu vou fazer paralelo aqui que eu acho que é bem importante.
But I will make a comment. When we saw the Cassiano presentations with COVID data, who were tested, their different age groups, the symptoms, and when we saw José's presentation now, which was also a presentation filled with data, with more than 30 years of HIV program, we are already talking about priority population groups and key population groups. So when we saw in Cassiano's data saying that 11% of people that went to drugstores to be tested were elderly people, but this was the age group that tested positive the most, perhaps we can establish this connection of who should be testing for COVID. This is why it's so important to have a public health program and a health surveillance in times of pandemics and during epidemics. Is Cassiano with us? So I'm going to ask Dr. Segundo to make a comment on the discussion we just had. We talked about the importance of fast tests in the drugstore, in the work environment, in basic healthcare. So how do you see that, Dr. Segundo, the use of rapid tests in this environment and how you monitor and validated that?
Algo muy importante, ¿no? El tema de atención primaria de salud.
So we've seen something very important. We've seen the strengthening of the use of tests in several presentations and the authorized tests in countries, different countries, even more complex texts. But the landmark of this pandemic was really the scale. The theme that you proposed and the use of several drugstores available in the country, pharmacies, to provide, more than 3,000 tests to the population. This was sort of a relief for the public healthcare system, because these people did not have to get to their hospitals or health clinics to get a test. And we've also seen that the percentage of positive cases with the rapid tests was low. And so that allowed for voluntary isolation and quarantine. So this is a very important approach. We work with the clinical evaluation in hospitals, and the next stages have to be scaled up so that we can bring those rapid tests to the community. Our team is working on an antigen test right now in a community center. We are actually closer to the more vulnerable population. So this approach is very important, not only to fight this pandemic, but future ones. We've seen what the Ministry of Health is doing regarding the 1990 approach. So we have to bring medication to the population who is in need, or the example of providing medication to the people living with HIV. So if someone with HIV is a little more at risk of having severe COVID, so that it's important to make sure that they have medication available. Thank you, Dr. Segundo. Is Jose back? Jose, would you like to make a final remark? I would like to thank Elliot and everyone else for staying with us. So I would like to invite Jose now to say his final remarks, talking a little bit about the importance of diagnostics, because throughout the years we've seen new technologies being implemented, and we have to include that in the pandemic discussion. Jose, over to you. Thank you, Ana Flávia. My connection is not working really well, so I would like to, just leave you a message, which is, with innovation, with technology evolution, we are able to implement innovative actions. We need that. We have to innovate, and we have to have courage, because back there, when we decided that we could do rapid tests, not everyone believed in it. So we have to innovate, and we have always to think about that. And when we talk specifically about the HIV epidemic, we have to show that this young population is getting infected, so we have to keep on innovating regarding the services provided by the Ministry of Health. We have to keep on offering diagnostics. We have to think that we do not have a lot of information regarding the incidence of HIV. We see that there's an important population, a part of the population that we're diagnosing later on. And so one thing that we really need to work on is the detection window. Tests with shorter detection windows will be very important to continue on fighting, so that we reach the 95%, because that's what we have to think. The closer we are of the total amount of people living with HIV, the better it will be, and we need better tests. Thank you so much. Thank you, Jose. Pablo, would you like to make any final remarks regarding the use of tests in primary health care. You mentioned the importance of updating policies. So are you there? Do you want to say final remarks? Yes, good evening, everyone. I believe that the use of technology at the point of care is really the way to go. We've seen that. There are several studies demonstrating that it will help to control diseases, especially when we talk about diabetes, hypertension, and we're also talking about hypothyroidism. So what we need to advance now is in terms of legislation. We have to have a legal basis for that and really shift the paradigm regarding pharmacists and biomedics that have this argument that say that we cannot advance in terms of technology. In the United States, for example, there are 136 parameters available at points of care. So why not use them? We have to think about the quality of life of patients. We cannot clinch on these issues. We have to advance and always putting in first place the quality of life of people. So people do not, they cannot be in line for hemodialysis because they cannot use a technology to control diabetes or hypertension just because regulation does not allow it. On the other hand, we also have to pay attention to quality. I mentioned that in my presentation. We do not choose any piece of equipment. We are thinking of devices that have external evaluation, and besides relying on external evaluations, we rely on our team to evaluate and guarantee the quality of the results of those tests. That is also essential. So those who benefit from rapid tests, the tests during appointments are the patients, and we have to think about them. Thank you so much. Dr. Cesar, would you like to say a few remarks regarding the use of tests at the point of care? Please go on, you have the floor. Yes, thank you so much. Thanks again for having me. So definitely the pandemic has brought us learning opportunities. So the test that we have today, just like Jose Alonso was talking about disruptive technologies, and Pablo Maciel that was talking about technologies as well, this is something that we are able to use to reach diagnosis to other people, and we have to think about technology and information systems, and sometimes it's a mistake to see that from a laboratory point of view only. Sometimes taking quick measures and responses during the pandemic, I mean, it was lucky that we did not have cases in the workplace, especially because of the use of these tests before sending them to workplaces. So thank you so much again for having me. I would like to invite Elliot to say a his final remarks regarding the equality of tests now. Thank you very much.
Yes,
the floor is yours.
Thank you very much. Just three things that I jotted down, not necessarily related to quality. Quality is essential, of course, but at the same time, access is also essential. And anything that can be done to increase access is critical. New technology is wonderful, but if it can't be used by the people who need it, then it doesn't have a lot of value. The second thing is, I think we can learn from the pandemic. We have opportunities here on how to bring forward new tests quickly. We should concentrate on learning lessons from what we are experiencing right now. And the last thing is I would advocate for regulations to not only consider risk, but also to consider benefit. It's important that a number of speakers have talked about that today, that if the benefit outweighs the risk, then it would be that would be a good opportunity to have the regulations keep that in mind. So thank you very much.
Obrigada a todos os participantes por terem continuado aí conosco.
Thank you very much to all the participants for staying with us. We will be back tomorrow at 9 a.m. Brazilian time with more interesting panels. We will talk about self-testing. We will have the experience of new technologies being incorporated in the Brazilian healthcare system so that other technologies are incorporated. So thank you very much again. Thank you, Dr. Segundo, who is here on the stage with us, and to everyone watching us. Thank you so much. Have a good evening. Bye-bye.